Good morning, everyone, and welcome back to our ISI video channel where we discuss various topics related to international students and their health insurance needs. As we've adapted to a more virtual format of communication over the past couple of years, we've seen many companies and businesses follow suit. The same holds true for healthcare, as telemedicine has become more popular than ever with the convenience of seeking care from home. Today, we're joined by ISI's Customer Service Manager, Yessica Prato, who'll go over the ins and outs of telemedicine and how to use this new technology to your full advantage. Jessica, thank you so much for joining us this morning. Could you start us off by explaining a little bit about what telemedicine is exactly?
Thank you, Sally, for having me back again. And yeah, of course. So, telemedicine is basically a virtual doctor's visit. Doctors can be contacted by phone, by chat, by video, and they're able to evaluate you, they're able to diagnose you, and treat you as a patient.
Exactly. Yep. You can seek treatment from home. I've used it myself. It's super convenient. Can you tell us the types of treatment that telemedicine can be used for?
Of course. So, usually telemedicine visits can be used for anything that's a non emergency. So, think about things like a cold, a sore throat, maybe a skin condition, an infection. Doctors can also refill prescriptions for you, and they can even treat mental health conditions like anxiety or depression.
That's so great. Yep. It's so nice that you don't have to go all the way to the doctor's office, wait 3 hours. They can just pop
Mhm.
right in. You can just be on your couch. It takes 10, 15 minutes. There's some clear advantages there and so many different things that you can seek treatment for with telemedicine, like you just said. What are some additional advantages of using telemedicine?
Yeah, like you said, telemedicine does have great advantages. I think COVID-19 showed us the true power of technology, and it kind of pushed us to rely more and more on computers and phones. So, with telemedicine, you can speak to real doctors, from the comfort of your home without exposing yourself. And these doctors, as I mentioned before, can write you prescriptions and treat you virtually. Telemedicine also sort of adds an extra level or layer of privacy from the already established HIPAA regulations, since you really don't need to interact with anyone other than the doctor. And furthermore, many insurance plans offer telemedicine as an in network provider, which basically means that you won't have to pay for the visit upfront, but rather they will bill your insurance company directly.
Great. Yep. Those certainly are some additional advantages. And like you said, if you're sick and you don't want to expose yourself to anyone or be further exposed, it's a great way to seek treatment. And
Mhm.
then you mentioned insurance as well. Can you dive into that a little bit deeper with how insurance covers telemedicine or how that works with different plans?
Right. So many insurance plans, including ours, now cover telemedicine as any other medical visit. So, obviously, for more information, you want to make sure that you contact your insurance carrier and make sure that they do cover it. And if you have any out of pocket expenses, such as a copay or maybe a deductible that you're responsible for, but many of them include the service now in their benefits.
Perfect. And as we've been talking about, telemedicine offers treatment for a multitude of issues. And throughout the pandemic, we've seen mental health really come to the forefront in terms of people
Mhm.
seeking treatment, it being discussed. How does that work with mental health?
Right. So that's a great question. It is a very important topic right now. If ever, many mental health providers have also been forced to pivot during this pandemic. And many of them are now offering mental health sessions online. So you can speak to your primary care physician, to your therapist, maybe your psychologist, and they can treat you, they can help you develop a plan based on the symptoms that you're having.
Perfect. Yep, I've
Mhm.
seen lots of different companies advertising with telemedicine or virtually, like BetterHelp, other companies as well. So there's lots out there, and it's great that you can connect virtually or text. So a wonderful thing that's being done here. Any other tips that you would suggest for students that are utilizing telemedicine?
Yeah, so whenever the people are using telemedicine services, I would definitely recommend that they have, if they're using their computer, check that you have a good internet connection. That's very important. And also that you have a private space because you want to feel comfortable. You want to feel like you can discuss anything with your doctor. So make sure that there isn't a lot of background noise, maybe use your headphones, but so the doctor can hear you clearly. Now, keep in mind that while telemedicine is a great tool, it won't replace an in-person visit if, say, for example, you need lab work or you need any sort of treatment that needs to be performed in person. So for any true emergencies, make sure that you do go to the doctor or the hospital.
Perfect. Well, thank you so much, Jessica. And like you said, it's important to go to the nearest hospital or seek treatment in person for conditions that are more urgent or that
Mhm.
require you to have face to face or like lab work, like you said. Thank you so much for all of your insight today. If you have any questions about telemedicine or what insurance plans that we offer that cover telemedicine, feel free to give our customer service team a call or send us an email. We hope that this has been helpful, and we look forward to seeing everyone next time. Thank you so much.